study was undertaken as part of the Global Psoriasis Atlas, and this is an atlas which forms part of the ILDS as well as led by Professor Griffiths and other colleagues. There was a number of colleagues that came from the UK, from Paris, and of course local dermatologists, and this was a community-based study to look at the spectrum of diseases in a rural setting in South Africa. This study is important because if you look at the data and prevalence of psoriasis, we really don't have data on low and middle income countries, and in particular we don't have data on psoriasis or skin diseases in rural settings. So the Eastern Cape is the province where I come from, and is one of the poorest provinces in South Africa, and there is no data on skin conditions and spectrum of skin disorders in this community. So the study was a community-based study, and the main findings was that skin disease is actually common in the rural Eastern Cape, South Africa, and there is also a challenge of lack of access in terms of patients having access to dermatologists, as well as the knowledge of common skin conditions. So this study is actually going to be very impactful in South Africa, and I guess globally, in that now we know these conditions that are common in this community, and we can also implement the impact is that in South Africa, because there's the shortage of dermatologists, and this can be addressed by actually training more medical officers or community workers, just to at least identify the most common skin conditions, and should be able to refer those before patients get complications from the skin conditions. So it gives us data on access, gives us data on the common skin conditions that we saw, and the fact that access to skin dermatologists is still challenging, and it is something that we need to focus on. And we're happy also to learn that WHO has recognized skin diseases as a global need, and they need to be recognized.